This time, turn it over to Kandace Allen. Thank you to Share Medical Center, Kelly Parker, Kandace, for hosting us this morning. Kandace.
Thank you, Alex, and thank you for the great turnout this morning. Real quickly, I want to introduce Lindsay Pruitt. She is our new PA seeing patients in the clinic with Dr. Kinsey. Lindsay comes to us from Durant, Oklahoma. She's got about 3 years experience and in internal medicine practice, and she's here seeing kids as well, so we want to welcome her. She's been quite busy and has gotten off to a good start. So Lindsay, we welcome you to Alva. And one more thing I want to mention, we do have a new CFO that's going to join us here in the next couple of weeks, Kevin O'Brien. He's a native of Gage, Oklahoma, and has been at Shattuck for the past almost 20 years, and he will be joining us March the 10th. He will actually be on site. He's going to do some training at Shawnee for the Meditech system, so when he gets here he'll be all ready to go. So we look forward to Kevin joining us as well. Real quickly, I want to go over a few things. I know you all have heard and see on TV and read in the papers the challenges that we face in healthcare today, financially especially. It's getting tougher and tougher to keep those doors open. One of the important things, hot topics you keep hearing about is Medicaid funding and accepting federal dollars for Medicaid expansion. It is very important. Approximately 1 in 6 Oklahomans are either uninsured or underinsured. That would help fill that gap. Using the governor's timeline through 2020, Oklahoma hospitals will experience a $1.6 billion reduced Medicaid payments. Oklahoma hospitals provide approximately $600 million annually in uncompensated care to the under or uninsured who do not currently qualify for Medicaid. Hospitals provide much of this care in the emergency room setting, which is your highest primary care setting. The cost of health care to the uninsured is paid by all of us here, and if we do not get this money to help compensate for that, you and I will see increased premiums even further to help compensate for this care. If Oklahoma does not expand Medicaid or accept the federal dollars, those dollars are set aside specifically for that purpose. If we choose not to accept those dollars, that money is going to go to other states. So we need to accept those dollars for these eligible people, and the loss of $1.6 billion in other federal payments is in effect sending the Medicaid expansion dollars to other states. These cuts imposed by the Accountable Care Act include $1.13 billion in reduced federal payment rates for services to Medicare patients, $109 million in Medicare reductions for quality-based payment changes, and $387 million in reduced Medicare disproportionate share payments. So the bottom line, Oklahoma faces more than $1.6 billion in federal funding. The return on investment of expanding Medicaid to our state's bottom line and to our citizens' overall health would be huge. We cannot ignore this need. I have a lot of information on the Medicaid accepting the federal dollars, so if you have questions, please come see me and let's talk more about it, because it's a very important issue for hospitals in Oklahoma. Does anybody have any questions? Okay, thank you.